Hi, I'm Tarae Rose, and I'm here with Pediatrician and Eating Disorder Specialist, Dr.Sacker. So after graduating from UCLA of medicine, how long did it take you to decide you wanted to practice in New York?
Oh my God. That's really my wife's decision. My wife said after I left UCLA, she said, why don't you apply for your residency in New York? So I didn't even think about California. I applied to 3 places in New York. I visited NYU, that was my first. I visited the Bronx, and I visited a place in Brooklyn. NYU was my first choice. I got my first choice and lived in the Village in the late 60s.
And when did you decide when did you take an interest in eating disorders?
Oh my God, eating disorders occurred later. I thought I was going to be just a general pediatrician. I mean, I'd walk around with a black bag. And when I started my residency at NYU, I realized that pediatrics only went up to 12. That if you were 13 years of age, you were considered an adult. So therefore, you were seen by internal medicine doctors, people who didn't have any clue as to how to handle, pediatric cases. And I asked a very simple question to the chairman. I mean, thinking that, hey, this is an obvious question. I said, Dr. Krugman, I said, what about the field of adolescent medicine? He looked at me like, what do you mean? I said, well, why should pediatrics end at 12? Why shouldn't we incorporate individuals who are older than 12, maybe as old as 18 or 20? And he said, I'll make you a deal. I said, okay, wait a minute. What's the deal? He said, there are 2 programs in the entire world right now that will train you for adolescent medicine. One is in Boston and one is in Los Angeles. I said, Los Angeles? I said, that's my home. He said, that's my best friend's program. He said, I'll make you a deal. I'll send you to LA in adolescent medicine, provided you come back and you become my chief resident and you develop an adolescent program here at NYU. So I figured, I've got nothing to lose. I'll go back home. I haven't seen my parents in a while. So I went back to LA and began an adolescent fellowship. On my first day, literally on my first day, and it's written in the book, Regaining Yourself, that I just gave you. When I first came in, they said, Dr. Sacker, your patient is waiting for you up on the 8th floor. I said, whoa, they must think I'm really special. I haven't even been oriented yet, and they're already telling me that I have a patient up on the 8th floor. I go up to the 8th floor, and here's a mother and daughter. The daughter must have been about 16, and they were in this cat fight. They were pulling each other's hair, they were throwing each other down. The mother grabbed the daughter's purse, emptied the purse, and out came a bunch of white little pills, which later on turned out to be speed. And the 16-year-old at that point weighed about 60 pounds. And that was my first eating disorder patient that I've ever had. She needed to be admitted. She couldn't be admitted at the hospital we were at. She needed, because she refused, so she needed to be admitted to a county hospital. So they dropped her off. They brought her into the emergency room and smartly just dropped her off. And she took off. About 2 o'clock in the morning, I get a phone call from the state police saying, is this Dr. Sacker? I said, yes. Well, there's a young lady here that says that you're the only person that she wants to talk to. So this was a young lady that I had seen at LA Children's Hospital. She admitted to wanting to come and see me, and she allowed me to admit her to the program. 6 months later, she was well. If you ask me what I did to get her well, I will tell you I have no clue. I was just who I am, just like I'm talking to you right now. And after that, people, since there was no history of anybody treating anyone with the eating disorders weren't even really known. This was the end of 1970, beginning of 1971. The only eating disorder that people knew, during that period of time was like Karen Carpenter, who was the lead singer of a group who had died from anorexia. And people began to hear that I had treated this one individual, so more people began to show up and wanted to see me. And by the time I got back to New York as chief resident and was working on setting up an adolescent program, my name became associated with eating disorders. And then while flying back and forth between a number of cities in the States, At about 37,000 feet, I came up with the title of my first book, which was Dying to Be Thin. And after that, it just became part of what I was doing.
And about your book, you've written several books, but how did you come up with the title Dying to Be Thin?
37,000 feet in an airplane, I wanted to go and reach people to make kind of a statement about eating disorders. And I thought about, thin, wanting to be thin, It didn't, and all of a sudden I came up with Dying to Be Thin. And it clicked. It became kind of, I don't know whether the book was that good, but it sold, I think the first week it sold over 35,000 copies, which at that time made it a bestseller for that kind of material. And overall, I think it sold 165,000 copies. So it became a bestseller. And then 20 years later, almost to the day, my associate said, I think it's time for you to write a second book. I said, what makes you think I should write a second book? And she said, I think you know more right now. I think you realize that it's not just an eating disorder, it's an identity. And regaining yourself became the title of that second book.
And what are some of the signs that may indicate someone has an eating disorder?
Everybody wants to kind of think that when we talk about eating disorders, that it's one disorder, it's one disease, or it's either anorexia or it's bulimia. Eating disorders are a spectrum. On one end is anorexia, the restrictor, the person who restricts food, goes on this massive diet, loses a significant amount of weight. And on the other side of the spectrum are people who are binge eaters, binge eating disorder. So you've got an entire spectrum between anorexia on one side, people who binge and vomit on the other, people who just binge eat and don't vomit. So they're all an entire spectrum of an illness. And the illness is really more about control than anything else. And there are usually three major symptoms. They're usually perfectionistic individuals, people that really work hard and really care about what they do. Obsessive compulsive disorder, where they're always kind of thinking about the same thing over and over and over again. And anxiety, both the anxiety that we feel from outside sources, from outside stressors, and internal anxiety. And the real issue of each person that winds up usually having an eating disorder is that they don't feel that who they are is good enough.
And so what advice would you give to a parent or a relative that knows a person with an eating disorder?
It's really tough, including friends. Because people that have eating disorders, want to own it. They don't want to relinquish it. They're not unhappy oftentimes because that's the way they feel that they're in control. So the important thing is, number one, is to make them aware that you're concerned. You've got to come from a position of concern. If you don't come from a position of concern, you start telling them, well, you've got to eat. It doesn't work. What they're going to do is they're going to tell you where to go, excuse my language. So you've got to come from concern. You also, if you're a friend, then bring a group in and say, you know what, we're all concerned about you. We'd like to get you help. The biggest problem is that a lot of doctors don't realize how to treat eating disorders. So you've got to find somebody who really specializes in the treatment of eating disorders. Because they will run blood tests, and the blood tests may come back looking normal. What they don't know is that when you lose a lot of weight, that the volume of blood in a person winds up being restrictive, so that all these metabolic tests that come back all look like they're within normal limits. But these people are chronically dehydrated. So as soon as you begin to give them fluids intravenously, you notice that all the values wind up coming out very low. So the first part is that parents need to be aware of it. The second part is they need to find somebody who can really help them with it, and not just think that it's all about weight and gaining weight and eating more, because that's not the issue. It's really about how the person feels about themselves and their own identity.
So you have been on Oprah, Good Morning America, CNN, and hosted other shows, but what has been the most gratifying for you throughout your career?
Whoa, that's a big question. I don't think there's been one moment that's been more gratifying than another. I think the most serious was a young girl who I treated when she was 5.5 years old that had been missed by a number of pediatricians, and they called it growing pains. And by the time that I had seen her, it turned out that she worked for somebody. Her mother's boss was someone whose daughter I had treated. So they said, why don't you go and see Dr. Sacker? So when I saw her at 5, I realized that this 5-year-old knew exactly what she was doing. What she was doing was, and her teacher is the one who picked it up in school, she was eating pieces of paper and flipping pieces of paper. She was taking little parts of her book and flipping it in her mouth and using that, as a mechanism of decreasing her appetite. And then after she would eat a meal with the whole family, she would go into her room and run track. And she kept like this odometer which measured the amount of miles she was running in her room until she burned off enough calories after she ate. What was gratifying about it is I had no idea how to treat her. She's 5 years old. The way that I wound up treating her was I saw that what she loved, I found that what her passion was horses. She loved to draw horses. And I had another patient who I had treated who I sent to a program where they had what was called equine therapy, which is horse therapy. So I thought, let me call her, because she was doing some of this horse therapy here on Long Island. So I called her up and I said, look, I have a 5-year-old that loves horses. Maybe we can get her to start to work on, rather than gaining weight, we can see it as her getting stronger by her eating more. And what we can do first is, rather than teach her how to ride a horse, we can teach her first how to brush a horse, how to take care of a horse, how to walk a horse. We can do all these things up until she gets strong enough to get on a horse, and then we can teach her how to ride. And that's what we wound up doing. And she got better based on equine therapy. So of all the ones I treated, and then what was weird about it too was that's when I got a call. I was on Good Morning America, and then like about 3 days later, Oprah herself called me and said, hi, Dr. Sacker, do you remember me? I said, yeah, I think I remember you. And she said, you're the only person that ever rejected me when I first called you. I said, oh yeah. She had called me earlier about when she had lost all of her weight at one time, and she had gone on a liquid diet, and she wanted me to come on her show. And I would not come on her show because I didn't believe in liquid diets were effective. So she said, I'm calling you a second time right now. And I'd never done that before. I said, I would be happy to come on the show. And that's how I met Oprah.
That's amazing. But thank you for your time. And this has been.
I hope it was helpful.
It was very helpful. Thank you. And this has been the Tarae Rose Experience.